country, people will make.
Welcome to our interview segment on Saturday Treat, where we're looking at Lassa fever. Yes, we have reports that are coming to us from the Federal Ministry of Health that there have been outbreak of Lassa fever in over 12 states in Nigeria. Well, it's also reported in other countries like Liberia, Ghana, and other parts of the country. What exactly can we begin to do at this point that Lassa fever is in Nigeria? Well, this morning we'll be looking at the symptoms, the incubation period, and prevention, what we can do to prevent this virus. Well, joining me to talk about this is Dr. Taiwo Aremu. He is a medical practitioner here in the FCT. Welcome to Saturday Treat.
Thank you very much.
Well, before we start, let's, for the sake of those who don't know what Lassa fever is, what exactly is Lassa fever?
Lassa fever. It brings a goosebump when you hear that name, Lassa fever, in Nigeria today. Lassa fever, from the medical sense of view, it's an acute viral hemorrhagic disease or illness of 1 to 4 weeks. Acute meaning that it's between 1 to 4 weeks. Hemorrhagic because it has to do with something that has to relate with blood. And then it's an illness, a disease that you can never think of. Although its symptoms are very non-specific. From the word Lassa fever, that means there is fever, high temperature.
Oh. So all the symptoms of malaria is also the symptoms of Lassa fever?
Yes. A patient with Lassa fever would most likely present with non-specific symptoms. They look like malaria, like headaches, like fever, like stomach pain, like diarrhea. So you cannot pinpoint that this is Lassa fever when you see it firsthand. But it takes a lot of specialty to be able to find out, to be able to know. But at the end of the whole discussion, I think I will give you details of how you can be able to identify it in our environment.
So how is it contacted? The true food?
Lassa fever started from a mastomys rat. Fine, in 1950, that was when it was first described.
Okay.
And then in 1969, it was discovered. And it started from a rat, a mastomys rat. It's common in West Africa, fine. If this rat contaminates food items with their feces or their urine, then it can be contacted. So we're not saying that you have a contact with the rat directly. No, you don't even need to go that far. But that you have contact with their droppings, urine and feces. For example, when you have rats on top of gari, for example, they urinate on top of it. You may not know. On top of canned drinks, they climb on top of it, they drop their feces on it. You may not know. So contact with their droppings it's infective.
Okay.
And of course, person-to-person contact. Someone who has had contact with their droppings before, you now have a contact with such a person's blood items, body fluid, urine, saliva, and the rest of it, semen, vaginal fluids, then it can be contacted too.
But what's the incubation period for this? Because we know during the Ebola time when they say when one has Ebola, you take them to the hospital where they will be quarantined for, I think, 21 days.
Yeah.
So is it the same case here?
Yes. Lassa fever, the incubation period is just 6 to 21 days. Okay. 6 to 21 days, yeah.
So how does it transmit from person to person? Because you talked about rodent on top of gari. So if humans contact that, can you also transfer it from one person to another through like handshake or?
Yes, person to person. We're not saying people should not shake themselves. No, please, you can continue. But if you have contact with their urine, their blood, their body fluids, for example, somebody who sneezes or has catarrh and then blows out his nose, the body fluid, if you have contact with it, then it's transmissible. For married couples or for those who have, casual sex partners, you have contact with the body fluid of the guy or the lady, then it's transmittable. So from person to person, it's just via blood and blood products, body fluids generally.
Okay, now let's talk more about the symptoms. What exactly are the symptoms so that when we see one who is a carrier of this, we'll be able to identify them?
Like we said earlier, it's non-specific. Lassa fever, it starts with fever, usually high fever. Of course, sometimes they can have headaches, chest pain, can feel like vomiting. That's nausea. Some of them can actually vomit. Some of them may have diarrhea. Those are the early symptoms. Usually what we'd say is this, what we advocate in the clinics is this. If we see a patient with high fever, be suspicious because it's now endemic in the country. Be suspicious that this patient has Lassa fever, at least. Then you can investigate further to be sure that this patient does not have Lassa fever. Subsequently, the patient can start having, in the latter stage, when it's early, you have all those symptoms I mentioned earlier. Then at the latter stage, that's at the severe cases. That's when you now see the patient drawing blood from the nose, from the ears, from the mouth, from the vagina.
Is there any cure yet for Lassa fever?
Yes. We've had patients who have survived it. In fact, when you have acute cases that present early, it's believed that we have a case fatality rate of 1% so far, according to the literatures, 1%. That's when you catch it very early. It is treatable if we catch it early. But by the time you get to
before the 21 days.
Yes. What we do is, if a patient presents within that incubation period and you're suspecting, can take blood samples. Of course, that is done by a specialized group of people, practitioners. The blood samples are tested, and if it is found that this patient has Lassa fever from the virus Aremu viridae, then the patient can be treated. Of course, the patient will be quarantined like you do in Ebola and what have you. The patient will be rehydrated and, of course, managed supportive therapy, and the patient can get over it.
Well, are there contacts we could, call in case we notice Lassa fever around our environment? Because personally, if I see one who has Lassa fever, I don't think I want to touch that person.
Yes, if you see a patient that has Lassa fever, fine, it's normal to be very conscious and you want to help, but then be very careful.
So we shouldn't give a
we are not
helping hand.
It is not your duty. There are people who are trained to do the job. They are there to go and carry the patient and whatever. So you are not supposed to go there and start giving your humanitarian duty of trying to touch and help out and clean. And no, you don't need to do that. All you need to do is just contact the Federal Ministry of Health. But there's a number that you can reach. That's the epidemiology division. I have some numbers that you can reach. Do I dictate
so you could
them?
call them out.
Okay.
We'll also show them on the screen.
Yes, 080 37 87 9701.
Okay.
And 080 37 15 45 75. You call those numbers and they will respond ASAP.
Wow, so once you call those numbers,
yes, they will ask of your location and they'll be there with their team.
Okay. Well, in the course of our discussion,
yes,
you talked about high fever. What exactly is that?
Okay, high fever is a temperature that is greater than 38.8.
Wow.
Well, for you at home, you might not be able to know if the patient has, if your relative or whatever has has a temperature of a particular degree. But you just notice that the body temperature is high on feeling. It's enough. Just stop there.
So, Lassa fever is already in Nigeria. What
Yes.
can we do to prevent this virus?
Yes, prevention is better than cure. That's the common saying. If everybody can maintain a very good personal or community hygiene, then we can prevent it. We said it started from what? From mastomys rats. So in your environment, ensure that you clean your houses very well. Your environment should be clean. All garbages and baggages should be kept far away from your houses.
Oh, attract
With
rats.
that, yes, rat would not come closer.
Well,
And then in your kitchen, for example, your food items should be kept in rat-restricted containers. You can have containers where you keep them and they are covered. With that, rats won't be able to go in and then urinate and pass their feces therein. So with that, just the simple we can do from our own homes. Avoid rats. Fine, recently I discovered that there is an advocacy that will start rearing cats. Since cats and rats, they are enemies in quotes.
They don't go the same way.
So that with that, you can ward off rats from your own household.
Okay, but are there complications after recovery from Lassa fever?
Yes, there are complications. For those who have survived it, I think about 30% of them end up with deafness.
Deaf.
They become deaf. But of course, a good percentage of them within 1 to 3 months, will recover partially.
Well, for the sake of people who are not aware, is Lassa fever peculiar to just Nigeria alone?
No, we say it's common in West Africa, Guinea, Sierra Leone, Liberia, of course, and Nigeria. There's our neighboring countries. In fact, Togo too has it, Benin Republic has it. So it's common in West Africa, really.
Okay. Yeah. All right. Before we go, there's this. I met with some people and they told me that don't drink gari because if rat should, go on top of a gari and you drink it, you may contact Lassa fever. But those who use hot water to make their usual iba, that you can still eat it and nothing will happen to you. Is that true?
Well, I wouldn't say that you shouldn't drink gari because for me, I still drink gari. But the gari I take is the one I know that is well covered.
But before you bought the gari, you don't know where it came from.
Yes, really. But then, we're not going to say don't drink gari. Please drink your gari.
But be more careful.
But be careful.
All right.
Just look before you leap.
All right. Well, thank you very much, Dr. Taiwo Aremu. He is a medical practitioner here in the FCT. We've been looking at Lassa fever, the symptoms. Well, he has said a whole lot. Be conscious of what is happening around your environment. Please make sure your environment is very neat because Lassa fever is in Nigeria. We just have to be cautious. Well, Saturday Treat continues. We'll be right back.